begin. Hello everyone, I'm Dr. Lott from Acupuncture is My Life. Now in this episode, I'd like to discuss the effects of the coronavirus on the lungs and explain to you how this is viewed from an acupuncturist point of view. Now, if you've already watched my episode on the basic functions of the lung in Chinese medicine, you would remember that the lungs govern qi and respiration, they control the channels and blood vessels, they control the diffusing and descending of qi, they regulate all physiological activities, they regulate water passages, they control the skin and hair, they open into the nose, and they control the nasal mucus. Now, if you have not already viewed my episode on the basic functions of the lung from an Oriental medicine perspective, please take a moment and go back and watch it so that you may have some understanding as to what I'm talking about when I begin discussing acupuncture viewpoints, diagnosis, and treatment protocols. Now I'll begin my discussion by discussing COVID-19 from a Western medicine perspective. A majority of what I'm about to discuss, I already spoke on in the introduction titled Acupuncture and the Coronavirus. Now let's discuss what the coronavirus does to your lungs. The coronavirus is considered for the most part a respiratory disease, which basically attacks the respiratory tract, which includes your lungs. Now, when I say for the most part, the coronavirus does affect other organs throughout the body as well. Others being the heart, liver, and kidneys, your stomach and intestines, your brain, and overall your immune system. Now, I touch on the effects of these other organs from both an Eastern and Western medicine perspective in other episodes on this channel. Now, in continuing to touch on the coronavirus's effects on the lungs, this virus can cause a wide range of breathing problems from mild to extremely critical. Older aged individuals, as well as those with pre-existing conditions such as diabetes, high blood pressure, heart disease, HIV, may experience more pronounced symptoms. Now, when this virus enters your body, it usually comes into contact with the mucous membranes in your eyes, your nose, your mouth. And from there, it begins to enter healthy cells and produce new virus parts, whereby it begins to multiply and infect nearby cells. It does this by latching its spiky surface proteins to receptors on healthy cells with a focus on the cells within the lung. Now, here's the key reason, along with what I've already discussed, why it's important to wear some type of face covering out in public. You see, the droplets from an infected person's sneeze, cough, or even breath can enter your body via the air in which you breathe. Now, these droplets can also land on surfaces in which you touch, then touch your mouth, your eyes, or even your nose, which would then give the virus passage to the mucous membranes in your throat. Now, depending on how your immune system responds, you can begin to experience symptoms such as fever, dry cough, and sore throat. This is how the virus moves down your respiratory tract to areas that have more ACE2 receptors. You see, the viral proteins actually use ACE2 receptors to burst into cells. Most people simply experience a cough, fever, maybe a runny nose. They can also experience symptoms such as body and headaches, difficulty sleeping, sweats, chills as well. Others, it advances into acute respiratory distress syndrome. This syndrome tends to cause rapid breathing, a fast heartbeat, dizziness, and sweating. Now, tissues and blood vessels within the alveoli of the lungs become damaged, which makes it harder for people to breathe. Most individuals who develop this syndrome need to be put on a ventilator because more and more fluids collect in your lungs, which begins to impede the ability of oxygen to enter the bloodstream, which is a necessity for your organs to survive. The body's natural response to this is to trigger an attempt to breathe faster. Now, when this happens, you're at the critical stage of COVID-19. This virus is showing that it can launch a full body assault, causing damage far beyond the lungs. Lack of oxygen entering the bloodstream can cause many organs to fail. For example, when oxygen cannot be delivered into the body, the heart can come under severe stress and become permanently weaker. I spoke of this in the episode on acupuncture, the coronavirus, and the heart. Now let's look at things from a Chinese medicine perspective. Now the main function that's adversely affected as a result of being infected by the coronavirus, when it comes to looking at things from a Chinese medicine perspective, is the lung's ability to govern qi and respiration. A deficiency pattern in this case develops due to the fact that the lung's capacity to govern qi becomes compromised. The lung in Chinese medicine is considered the most exterior organ, and the lungs control the body's defensive qi, whereby the lungs in Chinese medicine are the first organ to be affected by exterior pathogenic factors such as wind cold and wind heat. Please remember the term wind heat because in my episode discussing warm disease, you will hear the term wind heat used because COVID-19 is considered a wind heat pathogen. Now, there are quite a few patterns that can affect the lung. There are empty patterns such as lung qi deficiency, lung yin deficiency, and lung dryness. There are also exterior and interior full patterns such as invasion of the lungs by wind cold, invasion of the lungs by wind heat, which in this case is related to COVID-19 and which, as I stated, is discussed in my episode on the theory of warm disease. Another exterior pattern is invasion of the lungs by wind water. You also have combined patterns that can arise as a result of infection, which is discussed in the episode on combined patterns relative to COVID-19. The more common pattern which lie as the base for all lung patterns is lung qi deficiency. This is definitely a pattern you would experience if you were to get infected by the coronavirus. Now, symptoms of lung qi deficiency are shortness of breath, cough, sweating, and a bright pale complexion and fatigue. A person's tongue would appear as pale, and their pulse would be empty, especially on the right front position. Now, a treatment protocol would be to tonify lung qi and warm the yang, because tonifying lung qi, that would help boost cell-mediated immunity of the lungs to help the lungs fight off this infection. I would use points such as lung 9, lung 7, CV6, Fei Shu, Shin Tzu, stomach 36, CV12 as well. I would also include tonifying the lungs herbal formula to go with it as well. I would also look to clear excessive pro-inflammatory cytokines from the blood to address cytokine storm caused by this infection. I would also look to nurture liver yin and nourish spleen qi to enhance immunity, and also nurture kidney yin to improve microcirculation to overall improve blood circulation. I would also attempt to reduce lung inflammation by harmonizing the lung and spleen relationship. There are several approaches a Chinese medicine practitioner can take in dealing with various lung patterns that develop as a result of being infected by the coronavirus. But best of all is to make sure you wash your hands often, and if you go out in public, practice social distancing and wear some sort of nose and mouth covering. Now don't forget to subscribe to my channel. And until next time, acupuncture is my life. What's yours?